So now we're doing our microneedle therapy. A microneedle is going to channel through the scalp. So it's the channels that are actually going to make our hair loss treatments work better. So it's a facilitator. So on its own, the microneedle is not a treatment. Okay, we're using the needle length that is 0.75 for where we want to get down to. We don't want to go all the way to the hair bowl, but we need to penetrate through the dermis. And what we've done here is we've prepared the scalp. So we've got a nice clean scalp from scalp cleansing. We have used our scalp tonic here, so I would normally open the follicle more to get extra benefit out of your microneedle. But what we're going to do is follow the microneedle therapy with some other topical treatments, and that's what your microneedle is for. So don't use it if it's not on a clean scalp. Don't share your microneedle with anyone. And what I'm going to do is section the head. So I've gone in half, ear to ear, and we're going to go from front to back. So now we've got these 4 sections to work on, so you get a bit of a pattern. This is our titanium microneedle. As we said, 0.75. The titanium is very sharp, so it actually doesn't hurt, and what you don't want is to draw blood. Okay, so we're going to get a pattern and we're going to put it on the scalp. For long hair like this, we need to roll this way. Okay, if you roll this way, you're going to get all tangled up. So we go on the scalp, and all we're going to do is roll backwards and forwards. 1, 2, 3. Okay, you lift it up and move it. 1, 2, 3. So 3 times is enough. Okay, the pressure you add is just enough so you can feel it. And then we take a section. Okay, I like to use a tail comb, so it's a comb with a tail. Flip the hair over, and we literally come through. 1, 2, 3. 1, 2, 3. 1, 2, 3. So this is probably the most time-consuming part, but it is so effective at creating all these thousands of micro channels to really get our safe hair loss treatments down to the target site. Important here is not to use microneedle with harmful ingredients, because it will get them down into the blood supply. So be careful, you know what you're physically using. And we're just going to keep methodically moving down through here in what we call these recessions. We are a bit more sensitive, so just back away off the pressure and just keep counting. 1, 2, 3. We're aiming to work over the entire head here, but sometimes we may just do patterns or patches or target areas as well, and we'll always help you with what your treatment area is. And just this little section at the side, we've got really fine hair there, so you can literally lift it up and just roll up in. Okay, and then you would do exactly the same on the other side. You can see the scalp is a little bit pink. That's quite normal, and those channels will close pretty quickly, so we need to move as fast as we can. I'll just stop and then show you the back. Okay, so we're doing the back section with the microneedle. We want to come through the middle. So again, doing our count. 1, 2, 3, 1, 2, 3, 1, 2, 3. I come down to this, what we call the occipital bone, and we leave the nape out because we can come through at the end and lift it all up. And then we want just those sections again with our tail comb. You're doing this by feel. You can feel where the microneedle's been. You've used your scalp cleanser. You may have a cold scalp from the scalp tonic. You can physically feel where the microneedle has been. So you just do it by feel. Some people like to use a couple of mirrors, but it can be tricky. It's all about just taking your time, feel it in, and just be patient with the process. You know, this is the most time-consuming part, but it does really pay off. And if you roll the way I am, you won't get all caught up in here. Okay, so we say we roll all the way around, and then as I said, at the end we would hold all this hair up in the nape, and then we literally just roll up into the nape. Okay, and if you ever get caught on a bit of hair, just be really gentle to undo it. Okay, so you would repeat that all over the head. So I would normally go front, front, back, back.